Hi, my name is Simeon Neil Asher, and the trigger point of the week this week is the pectoralis major muscle, or the Pec Major, as a lot of people know it. So let's have a little look in the software and see if we can find the Pec Major. Now, an important muscle in terms of cardiac or sort of chest pain, and we're going to cover that shortly. Let's just start by looking at the anatomy. An extensive anatomy, really. A large muscle twists on itself, and it has kind of three origins. There's a clavicular head, which is usually the kind of medial half, or sort of the middle part of the clavicle, and the fibers come this way. And then we have a sternal head all the way down the sternum, and then we have a kind of costal head, normally sort of the upper six costal cartilages as well. Now all of that power and might comes together, and it inserts here into the crest below the tubercle of the humerus, just below the tubercle of the humerus, or what's called the intertubercular sulcus, just by the bicipital groove. So, as we said, three kind of almost separate, but of course combined muscles, three kind of origins. So the action of the muscle is important. You know, it certainly adducts and medially rotates the humerus. The clavicular portions tend to flex and medially rotate the joint, and the sternal portions kind of obliquely adduct the humerus towards the other side. And it's one of the main muscles in the body used for sort of climbing activities. Now, again, it's one of those muscles that people like to sort of overwork in the gym, and it's often a place that we can see trigger points for people that sort of go to the gym. But let's talk a little bit about the pain map now. So an extensive pain map. If we look together, the clavicular portion tends to sort of radiate to the anterior deltoid, and pain strongly in that kind of anterior deltoid area, and the clavicular, the sternal part tends to manifest here in as chest pain, and also interesting. Look, it comes all the way down the arm, all the way to the little finger. What does that remind us of? Well, someone that's had a myocardial infarction, an MI. So someone that comes in with chest pain, crushing chest pain, pain radiating down into the little finger. Of course, automatically we have to differentially diagnose a cardiovascular origin, but often once that's been, people have gone through the route and they've been told they have no cardiac issue, it turns out that it can be associated with trigger points in the pectoralis major muscle. And of course, that's one of the beautiful advantages of a 3D map, is that we're able to sort of really study and look at that kind of pain map. So in terms of trigger points, another really important one is just in here. It's a bit in the midline of the clavicle, in the sort of 4th, 5th, 6th rib, anteriorly, and it's called the arrhythmia trigger point. And it's a trigger point associated with arrhythmia, or ventricular contractions. And it's a trigger point that's been noted by a number of cardiologists, a number of sort of viscerosomatic specialists or viscous specialists, associated trigger point with cardiac arrhythmia. It's interesting. In terms of indications, so we'd have someone that maybe has had a myocardial infarction, a heart attack, and sometimes we can have trigger points that can come into that Pec Major after a heart attack. So that's an interesting manifestation. Also, people that come in with chest pain, pain in the kind of upper rib area, pain in the anterior deltoid. Shoulder pain, also sometimes associated with golfers and tennis elbow. We tend to find trigger points manifested there. Respiratory conditions, hyperventilation syndrome, chronic fatigue syndrome. We can find trigger points in the Pec Major muscles there. Of course, one of the big predisposing and sort of maintaining factors for trigger points is posture. People with an upper cross posture, where they're sort of weak at pecs, they're sort of anteriorly brought, the glenohumeral joint is brought forward, and that can lead to sort of trigger points in the pectoralis major. Weight training, boxing, all of those power-induced sports, again, well worth looking for trigger points in the Pec Major muscle. So, as we said, a powerful muscle, a muscle we do see clinically, a muscle interestingly associated with myocardial infarction and with arrhythmias. And as we said, 3 separate heads which have 3 different distribution patterns. So that's the pectoralis major muscle. Hope you enjoyed that and found that useful. Very much look forward to seeing you next week, and we'll discuss another trigger point of the week. Thanks for watching. Bye.